All right. Well, thank you everyone for joining us this evening. To start, we're going to get started, and just a reminder, the video will be recorded for people to watch after. So we can just get started and they can always catch up when they are able to. So thank you everyone for joining us this evening. We'd like to first recognize our partners, Hawaii Public Health Association, Kaiser Permanente's Hawaii genKP, and the Chamber of Commerce Young Professionals for co-hosting with us this evening. So just to go over a little bit of the logistics for tonight, all attendees, as you enter, you will be muted. Feel free to switch your view to side-by-side viewing mode. That way you can see the slides and the presenters at the same time. To submit questions for the panelists, please click on the Q&A icon at the bottom. The chat box feature can also be utilized to share comments or if you're sharing resources. The webinar, again, will be recorded and available for viewing at a future time. And we will send out a follow-up email with resources related to our discussion, the link of the recording, and more information about upcoming events. So just a little bit about who we are. Hawaii Young Healthcare Professionals connects emerging professionals from all areas of health to build strong cross-sector relationships, develop personal and professional capacity, and positively impact our communities for a healthier and happier future. Our mission is to build and support a collective network of emerging professionals in Hawaii who positively impact the health and well-being of our communities. So what do? We host multi-sector networking events, talks with community healthcare leaders. Our hope is that as we go forward, we'll have more lunch and learn and educational forums, volunteer opportunities, opportunities for professional development, cross-collaboration, and help shape the future of healthcare in Hawaii. So tonight, join me in welcoming Sue Joun. She's the principal of diversity at Workplace Consulting Group. She specializes in innovative, implementation-focused, no-frills, diversity and inclusion training and consulting. Sue is also a professor at Suffolk University, where she teaches global human resource management, organizational behavior, and career launch classes. Sue was previously the Vice President of Talent and Diversity and Inclusion at Blue Cross Blue Shield of Massachusetts, where she led enterprise diversity and inclusion, talent acquisition, performance management, and leadership development, and associate engagement teams. In addition to expertise in diversity and inclusion and talent management, she has held leadership roles in IT, operations, marketing, sales, and call centers in various organizations and industries. This breadth of experience enables her to fully understand and speak the language of various business areas and leaders, allowing for true partnership to champion diversity and inclusion goals and programs. Her thought leadership on diversity and inclusion and talent overall has been showcased on Skillsoft's video library and on the Urban Update. We are so grateful for her taking time to share with us tonight, as she's located in Boston, so she's quite a few hours ahead of us. So without further delay, I'll turn it over to Sue.
Thank you. Good evening, everyone. Nice to be with you all. So today, again, my name is Sue. My pronouns are she, her, and hers. And for the next 40 minutes or so, I'm going to talk about diversity, equity, and inclusion, specifically in the workplace. So diversity, equity, and inclusion at the workplace. We'll call it DEI for short. And we're going to talk about that by covering a few areas. Number one, we're going to talk about what is it. Then we're going to talk about why do we want to be working on it. And third, how we end up working on it. After that, we're also going to talk about what are the challenges to diversity, equity, and inclusion? Why doesn't it just organically happen on its own? And then we're going to spend a little time talking about diversity, equity, and inclusion in Hawaii. Although Hawaii is very diverse, I would love to hear from you all if it's as inclusive as it could possibly be. So with that, we'll get started. So the best way to start is with some definitions. So what is diversity, equity, and inclusion? Let's actually break those three words apart. Diversity really means all the unique qualities that a person has. And in the old days, meaning about 10 years ago, we used to actually list out all those characteristics. We used to say race, gender, age, religion, sexual orientation, sexual identification, people with disabilities, and family dynamics, we would list them all and then finally realize there is no way to list them all. So it has become a much more broader definition of all the unique characteristics. However, I do just want to point out that a lot of times diversity is in fact still working mostly on race and gender. And those two demographic information is also what is most frequently captured as data points to determine if an organization is diverse or not. So that's diversity. The word equity is not the same as equality, and I want to make that clear. So equity means removing those barriers that prevents people from being as successful as they could be. Equality means everyone gets the same thing. Everyone starts at the same place. And while it sounds fair to treat everyone equally, unfortunately, there are many of us who's had barriers throughout their entire lives, and still now, where just being on equal playing field doesn't work. You have to remove those barriers for them to be able to be successful. So that's equity. Inclusion basically means not only recognizing, accepting, and engaging, but also leveraging those unique characteristics and differences for the purpose of making the business and the workplace even better. So that's diversity, equity, and inclusion. And that's what those three words mean. And like I said, moving forward, we'll probably call it DEI for short. So let's talk a little bit about why. Why does companies and organizations, and frankly, this doesn't just happen in the United States, it's happening globally. There are diversity, equity, and inclusion initiatives happening in governments and in organizations all across the world. And the reason why organizations are working on DEI is because of mainly two reasons. Number one, there are disparities. And the reason why we know there are disparities among women and race and people of disabilities and so on is because when you look at the statistics, you realize that it is not an equal mix. In fact, if you look in just about every sector, if you look in government and think about the majority of all US presidents so far, they tend to have been white males. If you look at the demographics of the current House of Representatives and the Senate, they tend to be mostly white males. And if you look at the private sector and for-profit organizations, Fortune 500 company CEOs, you realize that majority of them are, again, of the same demographic, white males. In fact, in Fortune 500 companies, there are more CEOs whose first name is Joun than there are women CEOs in total. So, and there are only 4 Black African-American CEOs. So again, and then even if you look in the nonprofit sector, again, the boards and the executives and leaders of nonprofits also tend to be predominantly white and usually white males. And when you look at that, you have to ask yourself, well, why is it that most of the folks who are in positions of power across all sectors is of one demographic? The conclusion is there must be some disparities. So diversity and equity inclusion work is done to help eliminate and help ease those disparities that we currently see. The second reason why organizations work on DEI is because it is actually good for business. A lot of people think that people work on diversity, equity, and inclusion because it's the right thing to do. And that's absolutely true. Of course, it's the right thing to do. And it turns out it's also the right thing to do for business. There are so many studies and white papers done on this, and McKinsey has done studies year over year. They did a major one in 2015, they did another one in 2018, and they proved that there is a direct correlation between organizations performing well with organizations who have ethnic and racial diversity and gender diversity in their senior level and board roles. It turns out organizations that have more ethnic and racial diversity in their senior level and on boards perform better than other organizations who do not have women and racial and ethnic diversity in their senior levels or on boards. In fact, they were able to calculate that if you have gender diversity in senior leadership, your business is going to do about 18% than your competitors financially. And if you have ethnic and racial diversity, you do anywhere between 32 to 34% than other organizations who do not have diversity. So there is conclusive evidence that diversity is good for business performance, financial performance. When you dig a little deeper, the question then comes, well, why? Why is that? Why is diversity good for business? And it turns out diversity is good for business for a couple of reasons that we'll discuss. There's many, but with the time that we have today, I'll talk about two of them. One is innovation. It turns out that more diversity you have, the more innovation you have in your organization. And when I say innovation, I mean not just innovation in an abstract way. It turns out diverse companies were able to bring products and services to market quicker, and they were able to make money from those new products and services more than organizations that were not diverse. That's how we were measuring innovation. And then in fact, some people ask, well, are diverse organizations innovative, or are innovative organizations diverse? And the answer is yes. When you look at innovative organizations, they tend to be more diverse than their counterparts or competitors. And when you look at diverse organizations, they tend to be more innovative. The other reason why diversity and equity and inclusion is good for organizations and for business is because of another reason. It turns out that it's good for decision making. And often people think of, well, if you have a diverse population, it's good for decision making because you have more diversity in the room, so you have different opinions and you get different perspectives. Absolutely true. Absolutely true. I'm sure you've heard in social media or on the news, companies who put out incredibly tone-deaf advertisements, and you say, oh my goodness, if there was some diversity in the room when they were launching that marketing campaign, someone would have told them that that is not the best way to go. So having diversity in the room absolutely bring those multicultural, multiracial, multi-gender, multi-ability lens, absolutely. But there's another fascinating reason why diverse groups make better decisions. Studies have shown that if you have a diverse group in a meeting, they actually look at information 40% more accurately. And actually looking at the information more accurately is what was leading to better decisions. So, why do organizations work on diversity, equity, and inclusion? Because there are disparities. It turns out senior leaders are mostly of one demographic. Because it turns out diversity, equity, inclusion, or DEI is actually good for business for a variety of reasons. So that's the why. Let's move on to how. So how do we go about making organizations more demographically diverse and more inclusive and more equitable? Because here's the thing, you could have diverse organization, but if you're not engaging them and including them and leveraging them, it's not going to be as effective. And if you don't have equality where you're moving some of the barriers that exist that will prevent diverse talent from being successful, it will also not reach its goals. And that's why we have diversity, equity, and inclusion all together. So how do you go about diversifying organizations' workforce, and how do you go about making it more equitable and inclusive? Well, there are many ways to go about it. One of the more popular ways is training. So organizations have trainings on many different topics, rather it's bias, rather it's microaggressions, rather it's cultural competency. So a lot of training is done to create awareness. Now, believe it or not, diversity and equity inclusion training, diversity, equity, and inclusion training has been going on for 20, 30 years. And about $6 billion is spent on diversity, equity, and inclusion training. But if you look at the demographics of leaders year over year, it actually has not shifted very much. In fact, as I said before, we have fewer Black CEOs than we have done before. In fact, ever since 1999, we've only had 18 Black African American CEOs in Fortune 500 companies. And this year we only have 4. So that number has not shifted, although $6 billion worth of diversity and inclusion training has been happening on an annual basis. So while training is incredibly effective to create awareness, without training on how to change behavior, it turns out it's not very effective. And I always joke that awareness does not change behavior. I'm fully aware that to be healthy, I should exercise more and eat more kale and sleep more, but that doesn't mean I'm doing it on a daily basis. And that's what was happening with diversity, equity, and inclusion, DEI, that even though we were aware of certain principles and concepts, we were not actually changing behavior. So one of the ways, like I said, that organizations go about creating DEI is to have training. And what we always recommend nowadays is training with knowledge of how to actually change behavior. Another way organizations go about creating DEI and advancing DEI is, of course, changing processes. So what they do is they take a look at the way they hire, they take a look at how promotions are done, but frankly, they also take a look at how meetings are run. Who gets to do most of the talking? Who gets invited to projects? So really taking a look at how are emails written, right? Really taking a look at how everyday work is done and seeing if there are any aspects that have bias in them or that are giving unfair advantages to certain populations and trying to remove those as much as possible. So those are 2 things that organizations do. There are, of course, a lot more, but for sake of time, I'll focus on those 2 ones. Like I said before, training has been the most traditional way of doing DEI, but very quickly changing process and changing behavior is really becoming the new way of achieving DEI. So moving on, of course, at the end of the day, people often ask, well, how do we know if we're diverse enough? How do we know if we're inclusive enough? What is the goals? So as some of you know, affirmative actions were put in place in the 1970s or so. And heavily, affirmative actions depended on quotas, certain percentage of certain ethnic groups or gender to be admitted into universities or be part of government contracts and so forth. Nowadays, of course, affirmative action and federal government grants and all that is still happening. And I know there's controversies about universities and colleges using quotas. But aside from that, most other organizations usually don't use quotas, mainly for these reasons. One, they don't want to tokenize anyone. They don't want to give off the impression that I was only hired because I'm a woman, or I was only hired because I'm a person of color, or I was only hired because I was Asian. And so they really don't want to put quotas in. And frankly, quotas were creating resentment among white Caucasian population. There was a perception that white Caucasians would have to lose out on something in order for people of color or women or people with disabilities to gain seats. They actually felt that they had to give up seats for people of color and other demographic dimensions to be allowed in. So there was just resentment building. So because of tokenism and resentment, really organizations don't use quota unless it's mandated by the US government or state government for contracts. Usually their goals is to constantly measure their demographic data. Well, first, have demographic data so you know what your workforce is made up of. But secondly, measure it year over year to see if you're slipping or if you're advancing. And the goal really is to keep advancing, to keep growing, even if by smaller increments, to keep advancing that number. People, of course, then ask the question, like I mentioned before, well, how do we know if we're diverse enough? And I often say, what does that even mean? That's like saying, is the organization when do we know if we're making enough money? I think the goal is to continue to be diverse as much as possible. So if you are growing in people of color, take a look at people of color and say, how about African American, Black? How about Asian, Southeastern Asian population? How about Latino, Latina, Latinx, or Hispanic population? How about people with disabilities? So constantly taking a look to make sure that you have as much mix of a workforce as possible. That is usually the goal, and that's how we end up measuring progress. Are the numbers growing in those dimensions? And then how you measure equity and inclusion is really to see hiring rates, promotional rates, frankly, also retention or turnover, as we call it in human resources, how many people are coming in and leaving. So we take a look at the exit or the turnover rate of people of color or other dimensions of diversity to see if it's higher perhaps than the white Caucasian counterparts and seeing if there's any disparities there. We also measure engagement surveys, job satisfaction surveys, put in certain questions about diversity, equity, inclusion, and see if those scores are improving over time. So that's how we take a look to see if, that's how organizations look to see if they're advancing in those goals and if change is happening. So I'm going to pause and see if there's any questions. All right, let's see. Would it be possible to get copies of business performance studies? Absolutely. In fact, if you Google McKinsey, why diversity matters, all those financial performance, business performance articles will pop up. So all you have to do is Google McKinsey, why diversity matters. The 2015 study and the 2018 study should pop up. The other question was, could you please provide an example of an organization that had success in this model? Absolutely. Diversity, equity, inclusion work takes a while. It's a journey. It took us a long time to get to this point, right? And so it's going to take a very long time to get to the next point. So it's really incremental changes. It takes years and years to continue to grow and change. The trick is not to just do one thing and hope it works. It's to do one thing after another thing after another thing, year over year over year, to continue to see the progress. There are many organizations that had success. Unfortunately, as you know, a lot of tech companies, including Google and Facebook, have not had success. But there are organizations like Vertex Pharmaceuticals that's based in Boston. They've had tremendous success in increasing their diversity and inclusion. They just appointed their first ever person of color woman as their CEO. They are leveraging their global offices to understand cultural competency. They've rolled out training. They've changed the way they recruit. So Vertex is just one of those examples. Red Sox organization, for example, our baseball team here in Boston have trained all their coaching staff, all their scouts, all their office folks, even Florida spring training folks, and to really change the way they recruit talent, baseball talent, but also how they do day-to-day management. I could keep going. There are so many other organizations that have had success. Eastern Bank, which is also here, has had success with that as well. So what's ironic though is a lot of the big name companies and the big brands that we're aware of actually doesn't have as much in-depth DEI programs as you would think. And they actually have not had a lot of success. But just recently, Facebook and Google made a commitment to make 30% of their senior leaders people of color by 2025. So we'll all be watching to see how that works out. If I'm new to the DEI work and have not much exposure to such training, how do I get started? So I guess the question is, do you want to do DEI as a profession, or do you want to bring it into your organization? And I would say the answer to both of that is somewhat similar. Read articles. If you go to Harvard Business Review and just put in search word diversity, there are tons and tons of articles and case studies that you will see on how diversity, equity, inclusion, what programs work, what programs don't work, what organizations have done, what organizations has been successful. So you'll be able to find all of those things there. So that's a great place to start. And of course, another good old favorite is TED Talk. Find those. But a couple of books I would also recommend, of course, is especially in light of all the recent events that has brought to the surface the continuous racism that we have in our country. A book that I would recommend is How to Be Anti-Racist by Ibram X. Kendi. It's an excellent book about policy and process changes to beat racism or to mitigate racism. And then there's another great book by Iris Bonet, and she wrote a book called What Works. The book is called What Works by Iris Bonet, and that's also a lot of information about how it focuses on gender in this case, but about how process changes that. So those are some great resources that you can do. And then I'll answer one more question, and then I gotta kind of move on, is how do we incorporate DEI into our work in healthcare industry, and as it relates specifically to understanding and providing care to underadvantaged and disadvantaged populations. Oh, there are so many ways. Number one, get educated on this. Health disparities, COVID-19, it's becoming more and more evident than ever before that there's disparities among race and, of course, social economic. We know that Black, African American, and Latino, Latina, Latinx populations their death rate is higher than other counterparts with COVID-19. We know that. And we also know about so many other disparities in healthcare, and I'll share two of them with you. One of them, for example, is the mortality rate of Black African American babies is double white Caucasian babies. And it turns out one of the reasons why that was happening is because doctors were not taking Black African American mothers seriously when those mothers were raised concerns about their health. The second example of healthcare disparity is it turns out patients who are Black or have darker skin get less painkiller, pain medication than their other counterparts. And when they were trying to figure out why this is, they realized when they surveyed doctors, not just doctors who've been practicing for decades, I mean recent doctors that just graduated from medical school, the survey clearly showed that doctors actually believe that people with darker skin feel less pain. So I feel that healthcare has an extra responsibility for diversity, equity, inclusion, not just for their workforce, but for the work with the community and patients, period. And I could go on. There's gender disparities. I mean, women are often underdiagnosed for heart disease, although heart disease is the #1 killer of both men and women. So I could keep going. So the way to bring it into your work is to get educated, talk about it among your colleagues, bring this topic on, understand about those disparities, survey your patients to see if they feel like they are being treated equally and well taken care of, and continue to have those conversations and change processes to eliminate as much disparities as possible. So I'm going to move on since it's 11:31. And we want to make sure that we leave enough time for questions at the end. I believe we're trying to aim for 15 minutes of questions at the end. So let's keep going. All right. So I want to make sure we talk about some challenges. So if we know all this, we know that diversity, equity, inclusion is the right thing to do. We know that it's good for business. We know that it retains workers. We know that it leads to better decision making. We know that it leads to better financial performance. We know about the disparities that exist. So why is it not just happening on its own? And it turns out there are obviously many, many reasons, but I'll discuss a couple with you today, just to get us started. One reason is bias. I talked about that before, bias, B-I-A-S. And bias basically is not a bad word. If you look up a dictionary, if you look up that word in dictionary, it basically just means judgment, an inclination, a preference, a leaning towards or away from something. So bias is really an opinion or a gut feeling you have about things. And bias could be both good or bad. I could have positive, feelings about you, and I could have negative feelings about you. And there are biases that we're conscious of, meaning I know about those biases. So maybe I believe a certain thing, and no matter what facts are to the contrary, I'm going to stick to my belief. And there's nothing you can do to shake me of it. But it's also as simple as, I have a preference for certain types of food, and I'm aware of it. I have a preference for certain actors. I'm aware of it. I like certain books that you may find boring. I like certain comedians that you may find offensive, so on and so forth. Where it gets dangerous is unconscious bias, bias that we don't even know we have. And sometimes it's called implicit bias. And every time we think we're being objective, it turns out that we may not be being as objective as we think. So let me cover a few things. Why does bias happen? We're good people. We're trying to be objective and find a fair-minded and open-minded. Why is bias happening? Well, bias is an automatic mechanism in our heads. And it's there so that we can survive by taking shortcuts in our brain. The reality is we get 11 million bits of information coming at us at any given time. We can't possibly process all that. We could process in our brains about 40 to 50 of them. We could only act on 7. So what that brain does is it takes shortcuts. So when we see something or someone or someplace new come in front of us, our brain does an instantaneous scan. And it doesn't discriminate if our knowledge comes from a Harvard Business Review article, something we learned at graduate school, something my crazy uncle told me when I was 10, something I saw in a movie, something I heard in a comedic routine. It does not discriminate. It instantly makes a match, and it puts it in that bucket. And that bucketing is called categorical thinking, or generalizing, or stereotyping. And we do this instantly over and over again. And because we have these biases, it actually prevents us from being more diverse and inclusive, because we have opinions about groups of people instinctively before we even get to learn more about them. One of the other challenges that happen, and I'll cover this quickly, but I want you to be aware of, this is really a thing. It's called the mini-me syndrome. And what the mini-me syndrome basically says is, we like people who remind us of ourselves. We feel more comfortable with people like ourselves. So think about your social groups and your professional groups. You're either connected by industry or by ethnic groups or by age groups, right? Or common interest groups or college or hobbies, right? And so we have a tendency to gravitate towards people who remind us of us. The reason why this is a barrier in the workplace, and this is a barrier to DEI, is because studies have shown that leaders prefer to hire people they feel comfortable with. And if leaders are continuing to hire people they feel comfortable with, they're hiring people within their own network. And if they're hiring within their own network, it tends to be of the same demographics. I hope you're all with me. Okay. And it turns out leaders prefer people who have similar communication styles, similar work styles, similar education, sometimes same college, same hobbies. I think you see where I'm going. If people who are currently in power are gravitating towards other people like themselves, the chances of the demographic of the workforce changing is very, very low. So there are, again, many more challenges, but those are two challenges I wanted to bring up because it doesn't come up very often. Okay, moving on. Oh, is there a question? I think I saw a question in the chat room. Oh, thank you. I appreciate people typing up my recommendations of books and so forth. So let's narrow it down now. So we talked about what diversity, equity, and inclusion is, especially at the workplace, what each of those words mean, why organizations work on this, how they often work on it, and what are the challenges to it not happening organically on its own, even though we are good intended, open-minded, good people. I wanted to spend a little time about DEI in Hawaii. And I would love to hear from you all about this as well. And I see more questions coming in. Okay, I'll try to get to them soon. So as you all know, Hawaii is very diverse. It's one of the most diverse places in the world. And it has this incredible mix of, I believe the latest stats is 38% Asian, 25% whites, 24% mixed, meaning 2 or more races, and 10% Native Hawaiian or Pacific Islander. And so it's incredibly diverse. However, what I would ask of you is it as inclusive and equitable as it could be? Is there some opinions and bias against people who are newer to Hawaii and who are newer immigrants? Perhaps their culture or their mode of working or their understanding of process is different than ours. And is there some negative bias about that? Is there more favorable bias for folks who've been in Hawaii for a long time? Is there preferential treatment for more Native Hawaiians than more recent implants to Hawaii? Oh, I forgot to tell you, unlike the mainlands, I believe less than 2% of your workforce is Black or African American. So obviously the challenges in Hawaii are very different than the challenges in mainland, but I would love to hear from you all in the chat function, if you could share your thoughts about, is Hawaii as inclusive, especially at the workplace, as inclusive as it could be? And is there any biases that are kicking into place? So while you type that in the chat room, I'll try to answer some questions that are here. All right, here we go. Let's see. Okay. Any insights into the benefits age diversity? I feel young people are often discriminated against because of their lack of experience. Absolutely, there's age discrimination in all different aspects. What's so ironic is that often young people who work in organizations say they're not being taken seriously because they're too young. And then I have older people in the workforce that says they're not being taken seriously because they're too old. So I always wonder, who in the world are we listening to? So absolutely there is age discrimination. There is both favorable and negative bias about millennials and Gen Z, for example, millennials being self-entitled and difficult, for example, or Gen Zs being, you know, more demanding and passionate. So absolutely there are age discriminations, and frankly, there's body shape discrimination. There's a lot of studies that show that people who are heavier are perceived as being unorganized and unambitious, and people who are thinner and leaner are perceived as being more ambitious and more organized. And multiple studies have been done on this, and there are absolutely negative bias against people who have heavier body shapes. So there are absolutely bias of all kind. Do you know what is being done to address inclusion in the production of diversity training being created by more diverse groups? I'm not sure if I understand that question. Do you know what is being done to address inclusion and production of diversity training being created by more diverse groups? I'm not sure if I fully understand that question, but I'll take a stab at it. What is so interesting about diversity is it's different by community, by community, by community. So women does not own the topic of diversity any more than Black African Americans own the topic of diversity, any more than Asian, Southeastern Asians own demographics of the topic of diversity and sexual orientation and identification and people with disabilities and religion and so on and so forth. So I think there is constant work being done to try to be more inclusive in diversity trainings, because often we tend to default to race and gender because that's where a lot of disparities are, but frankly, that's where a lot of research and studies are. Okay, any advice on how to form non-minority group serving as an ally? Yes, I have lots of advice on how to be an ally. I'm just trying to figure out the best ones. There's so many. A few that I'll start with is, there's so many ways. So let me start with workplace. And of course, this could be used in just regular society as well, outside of work. But let me start with the workplace and kind of get more general after that. Being an ally is bringing up topics of diversity, equity, inclusion at meetings and as decisions are being made so that people of color or women or people with disabilities don't have to. So being the one to bring up these topics, that's one. Second is to, when you hear someone raise these topics, to amplify it by seconding it and by insisting that that conversation continues. That's another way of being an ally. Third thing is constantly questioning all the decisions that are being made at work if it's been looked at through diversity and equity inclusion eyes. Is it disadvantaging any particular group? Is it accessible to all employees, so far and so forth? Also, when frankly policies about patients or the communities you serve is being decided, looking at that and seeing if it is in fact accessible, not just physically, but language-wise and cultural-wise, so forth, and social economically wise, for example, to different communities. The other way that you could be an ally is to self-educate. Self-educate. Learn as much as you possibly can on your own. Do the work, do the homework, become more knowledgeable, and strive towards having an understanding of why things happen, what happens, what communities are being impacted. For example, environmental work is incredibly meaningful and wonderful, but sometimes environmental work neglects looking at some of the impact on lower socioeconomic families, for example. If they're trying to reduce bus routes because of the amount of carbon emission, they also should take into consideration the families and individuals that rely on that bus to get to work and to get to school. So that's another way of being an ally. And then one other thing about being an ally is simply standing with someone, both figuratively and physically, standing along someone is incredibly powerful. So there's solidarity and there's volume of people. You know, there's a joke that says the only thing that separates a crazy person from a leader, the only thing that separates a crazy person from a leader is a follower. So I would take a look at those as examples. Before I answer any more questions, I'm going to quickly take a look at these comments. Oh, you are all amazing. Thank you for all these beautiful comments. I think diversity in Hawaii's workplace is lacking. I think larger demographics of our state makes diversity a challenge. Thank you. I think diversity, I agree, diversity's unique demographics makes it easier to sweep some issues under the rug. Absolutely. I am newer to the island and I definitely have seen and experienced more hostility because of race and ethnicity in the community. In the workplace, I've experienced even more inclusion, but still some stereotypes. So for some of you who feel that Hawaii has this all figured out, as you can clearly see, we do not just yet. In my opinion, Hawaii needs to do a better job of acknowledging and addressing its racial bias. Oh, wow. Macro-Asians and Marshallese, especially pertinent in healthcare, given how many come to Hawaii for treatment. Wow, great comments. I encourage you all to go and read them all. So I would think about, even though Hawaii is ethnically and racially more diverse than others, take a look to see if inclusion is really actually happening. Okay, so now it is time for questions. We have 12 minutes left, so let me get to some more questions. I want to answer as many of them as possible. Let me see. All right. I hope I'm seeing, oh, I see. Okay. I'm not probably going in a particular order, so bear with me. How have new employee orientation be utilized to improve organizations' equity, inclusion, and diversity strategies? Absolutely great question. Orientations, well, first of all, every employee who starts should get the same orientation. You'll be surprised. Some people get orientation and some people don't, for a variety of reasons. So they should all get the same orientation. And absolutely, educating the new employees about diversity, equity, and inclusion, especially as it relates to that organization, is incredibly critical, so that new employees know that the organization takes this very seriously and the things that are expected of them to be part of this diverse, equitable, and inclusive organization. So orientation absolutely is critical to that. Many organizations have used orientations as a way to share all the different DEI initiatives that's happening, but also frankly to advertise employee resource groups. Those of you who don't know what employee resource groups is, some organizations have created groups based on certain demographic similarities. So it could be a women group, it could be an LGBTQ A group, it could be a Black African American group, new to Hawaii group, so forth. And they actually used orientations as a vehicle to advertise these employee resource groups, so people know that they can have those as resources, but also as social engagement, but also know that the organization recognizes those groups. All right, so let me just click here and make sure I'm getting to that. The mini-me syndrome is particularly interesting to me as a hiring manager. How can I avoid this? Is there something, if it's something so ingrained? There are so many things you can do. First, now you are aware, right? So you can't get this out of your mind. So you are aware. A few things you can do is, number one, recruit from as wide of a net as possible. For example, if you're always recruiting from your competitors, take a look and see if you should be looking at other companies to recruit from. If you're recruiting from the same colleges and universities you always have, take a look at other colleges and universities to recruit from. If you have a referral program and a lot of people are coming into your organization based on people they already know, maybe ease the dependency on the referral program and look for talent elsewhere. So cast a wider net, Look for talent in places you normally wouldn't look for. That's number one. Number two, take a very close look on what are the characteristics you're looking for. If you're looking for a cultural fit, meaning are they like us, then you're not going to have diversity. You have to start looking for cultural adds. How are they going to be able to add to the culture we have to make it more diverse? So those are two ways. The third thing is take a look at your job descriptions. Your job descriptions based on how long it is or how it's worded could actually be excluding people and causing people to not want to apply or feel like they're eligible enough to apply. And then also take a look at your interview process, how you may be actually, because we're human, without noticing, we actually give slightly different treatment to different people we interview. If we like them instantly, we treat them better. And chances are they'll do better at that interview. If we're not sure about them, we actually tend to not be as friendly at that interview, which usually causes them not to be great at the interview. So that's some of the ways. There's a great resource from Wall Street Journal. It's an article on 7 steps to unbias your job search. I would Google that and that should pop up for you, and that'll give you 7 steps to de-bias your recruiting process. So here we go. If you want to create, we want to create a diverse board, but we don't have diverse folks interested. What do we do? To be very blunt, it usually means you're not trying hard enough, or you're using the same mechanisms to find board members as you always have. And so here are some things to do differently, perhaps. Again, look for a wider net. Do you really need a board member who has the ability to donate a lot of funds? Do you really need a board member that has experience in this industry? Maybe passion is enough. Do you want to maybe mix up, take a look at folks who have maybe utilized the services of your organization as potential board members? Maybe if you're a hospital, maybe a past patient would be a good member of your board. If you're a nonprofit of a food pantry, maybe someone who's been a client and has utilized the food in that food pantry may be a good person on your board. Asking your board members if they know of people in their network that may be interested in this work. Taking a look at board members of other organizations and seeing and reaching out to them to see if they would like to maybe be on your board, but also is there people they know of who may be interested on your board. So the number one thing I would say is keep trying and keep throwing a wider net of potential board candidates, and go beyond board members who are influential, powerful, and are able to make large donations. Okay. Let's see. How do we showcase our diversity? Oh, Brandy, you're awesome. You found the Wall Street Journal article. And it's in the chat room for those of you who are interested. How do we showcase our diversity in our resumes or cover letter when applying for jobs? That's a tough question. That's a tough question for 2 reasons. My goodness, we only have 5 minutes left. There are so many studies that show that being diverse, when it shows up on the resume, could actually negatively impact you. I'll give you a quick study. It's called the resume study. They took the exact same resume, word for word, bullet points, education, experience, everything's the same. The only difference is on one set of resumes, they used a white Caucasian sounding name, and on another set of resumes, they put a black African American sounding name resume. And when they sent these out, and they've done this test for decades, but they also just did it last few years, the white Caucasian sounding name resume got 40% more callbacks than the black African American sounding name resume, even though everything was the same. Here's the kicker. When they sent it to professionals of color, meaning when they sent it to hiring managers of color, the results were still the same. This is what we mean by systemic racism or systemic bias. Now, a Harvard professor decided to take that study even further. Same resume study, identical resumes, Black African American sounding name on one set, white Caucasian sounding name on another. And in the white Caucasian sounding name resume, actually added a bullet, has a felony record. And on the Black African American sounding resume, did not put such a bullet in, no felony record. Guess what happened? The white Caucasian sounding name resume, even with the felony record bullet points, still got more callbacks for interviews. Systemic. So here's some few thoughts. Number one, it's hard because I've often heard stories about people who whitewash their names, who make their names easier to pronounce. They take out things that may, show that they're diverse so that they don't get hurt by these bias. But at the same time, I also know that there are people, because organizations are also looking for diverse talent, and frankly, some people are kind of, I don't want to hide who I am anymore, are pointing out their diversity in resumes. So if the question is, how do I would say list your real name, even if it's difficult to pronounce, even if the spelling is tricky, state your full name, state your associations, state your involvement in the community, showcase it. Because at the end of the day, that's what makes you unique. And I know this is easier said than done, you all, but if the organization isn't going to give you an interview because of what is authentic on your resume, do you really want to work for that organization after all? So I know it's a complicated question, but I hope I at least attempted to answer it. Okay. Oh my, 11:58. So I'll try to answer one more question, and then I know that I need to hand it back to Brandy. Let me see. What are your recommendations on tackling this sensitive issue, especially in the light of current circumstances, working virtually, not speaking in person? And frankly, as you also know, all the recent events that's brought to light the intense racism that exists in our country, especially in the mainland, I know. But in the light of that as well, and in light of COVID, in light of working virtually, in light of not meeting in person. So all that in mind, I would say people are still people, rather we're meeting and communicating virtually or in person. Bias is not eliminated or disappeared because we're virtual. And we know this. So I would say my recommendations for this is the same as my recommendations for others. Rather it's for being an ally, a hiring manager, or any other role that you may be playing. Bring up this topic in your meetings. Tell them you just went to a training on this, or you just went to a session with Hawaii Young Healthcare Professionals, and you learned about these things, and you wanted to mention them and bring them up and see how it's relevant to your organization. Ask yourself, are you as being inclusive as you can at your virtual meetings at your organizations? Are there some people that are being ignored? Are there 3 to 5 people who does most of the talking? Are the rest more quiet? Do they not have abilities to disagree? So point those things out and look out for those as much as you can. And frankly, we make judgments even on video. Depending on people's background, we make judgments. We make judgments on people's video being off or on, we make judgments. And that is incredibly flawed because we're working from home and there are so many disruptions. Video off does not mean you're not engaged or think the meeting is not important. So I would say continue to bring this up. And while it is sensitive, you could also frame it as, I heard diversity, equity, inclusion is really necessary for organizations to survive and to thrive because it's good for financial performance. It's good for decision making. It's good for innovation. So I hope that helps. Okay, I have to stop. Thank you so much for all your comments. Oh, I'm so glad. Thank you for being engaged. Thank you so much for joining me today. Thank you for all the fantastic engagement in the chat room and all these fabulous questions. I wish I could answer them all. Thank you for sending them. And HYHP, thank you for having me today. I'm going to turn it over to Brandy.
Thank you again, Sue, for joining us and spending your evening with us. It's very late there, but we really appreciate it. Thank you so much.
Absolutely. Absolutely. Would you like me to stay on or would you like me to log off? Whatever works best for you, Brandy.
You're okay to stay. Yeah, we're just
Okay.
going to go over the next, we have an event coming up on July 9th with Scott Simone of Simone Leadership Group. And he's going to go over with us how mentors, sponsors, and coaches can boost your career. So please feel free to join us on July 9th from 5 to 6. And then just a friendly reminder for those of you who are not HYHP members, now is a great time to sign up. If you do sign up between now and July 31st, 50% of your dues will be donated to Hawaii Homeless Healthcare Hui, as well as any other renewals. If you are a current member and want to renew your membership, you may do so. And 50% of your renewal will also be donated to Hawaii Homeless Healthcare Hui. But without going any further, we will send out the list of Sue's recommendations and reads, the books. And thank you all for joining us.